Hi, I'm Dr. Lenore Coleman, President and founder of Healing Our Village, and also Executive Director of Total Lifestyle Change. That's my nonprofit, and I want to welcome you today for our ongoing every Saturday program called Sugar Busters. As you know, those of you that have been with me over the last few months, Healing Our Village is a certified diabetes education program. So we take care of patients that have a diagnosis of diabetes, especially those that are not at their goal blood sugars and not at their goal blood pressures, not at their goal cholesterol. We work with our patients to make sure that all of their numbers are in the right range so we can prevent the complications of diabetes. That's what this is all about, folks. We're trying to prevent kidney disease, heart disease, blindness, amputation. You know, there's people that say that diabetes basically affects one organ and one part of your body at a time. So, we do not want to have people continue to have to go to dialysis 3 times a week when all they had to do was control their blood sugar and their blood pressure. We should not have anybody losing their limbs because of diabetes out of control. We are in a wonderful time. I know it's rough out there. I know we got this pandemic going on, but I really am starting to feel real good about the fact that we're getting ahead of this thing. I got my first vaccination on Monday of this week. I'm excited. I get another shot on March the 3rd. I can't wait to get my next shot so that I am completely immunized from the severe complications of COVID and hopefully won't go to the hospital with COVID-19. That's all I care about. What Coleman cares about? Coleman cares about not dying. Okay. I got a lot of living to do. I'm going to be here for another 30 years at least. So I've already figured out where I'm going, who I'm going with, what I'm going to do when I get there. So I have a lot of stuff that I still have to get done. My journey has not stopped yet. So I want all of you to think about this the same way. And everybody, I want you to start looking for ways to get vaccinated. All right. Listen, I'm in Georgia. There is no vaccine here, only for just a few people who are in skilled nursing facilities and assisted living facilities, a few healthcare workers. But by and large, if you didn't fit in that category, you couldn't get on the waiting list, even to get an appointment. I went over to the vaccination site that was in my county, and they were giving vaccinations. And I told them that I was a healthcare professional. I was 67 years old, and I should be able to get a shot. And they said, well, we already have appointments for today. So you know what I asked them? I said, hey, so what if somebody doesn't show up and you got one left over? Can I come back and get it? And you know what they said? Yes. That's what they said. So I came back. Somebody didn't show up. They had a dose and I was able to get it. Because you know what? I was motivated to get this shot. So we need to be creative. You need to talk to your county health department. You need to figure out where your vaccination centers are. And we need to try to be proactive at getting this vaccination in order for us to stop this death and dying. Remember, the hashtag for Healing Our Village is no more funerals. So that's what we're about. Now, today's Sugar Busters episode, as you know, we have 6 segments. This segment today, we're going to talk about men's health. And what I do is I go through all 6 of our segments every week. And then once I get to the end, then we start back at segment 1. Because there's over 30 million plus people in this country that have diabetes. And a third of those people don't know they have diabetes. So we're going to continue to repeat Sugar Busters every a week. And this gives you the opportunity to ask me questions. I'm actually on my Facebook page right now. If you put something in the chat or a question, I'm going to see it. I'm looking at it right now. So listen, knowledge is power. That's my tagline for my company. You need to know about your health. The more you know, the better you're going to do. So I encourage you to send me a question. If we can't get to, I'm waiting for the day that I have so many questions that I can't get to them all. That's what I'm waiting for. So for those of you who are watching on Facebook, call up everybody you know in your family that has diabetes. Call up everybody in your church and everybody at your job. I'm trying to heal the village, folks. This isn't just a cool name, which it is actually a pretty cool name. But this is actually my purpose and my mission in life. I'm serious about this, healing our village. And so we need to make sure that you are not misinformed. There are so many people that do not understand what's going on with their body, don't understand what's going on with their diabetes and their high blood pressure and their high cholesterol. So, we got to stop all the ignorance out there. This is important. You need to know everything you need. You listen, for you sports fans out there who are getting ready to watch this Super Bowl, you probably know everything about Tom Brady, I think his name is, the quarterback. You know how many completions, you know how many Super Bowls he's won, you know how many yards he's gotten, you know everything. But you can't tell me about your medications you're using for your diabetes. I mean, think about that, all right? So as much as you guys know about football, and I know nothing, I need you to know the same level of knowledge about what's going on with your body and the diseases that you have, all right? So we're talking about men's health today. And men's health is an important topic because men tend to not pay attention to their health. They go to work every day. They're focused on making that money. They're focused on taking care of their family. And they don't want to think about the fact that maybe there's something wrong with them. So they're always in sort of a state of denial. And it's usually the women in their life or their significant others in their life that encourage them to get help. So we're trying to talk about some of the men's health issues that are taking out some of the men earlier than they're supposed to be dying. And we're going to talk about that. It's a brand new year. We're in 2021. Everybody needs to go get a full checkup this year. Make your appointment now so you can get all of your tests run, all of your blood tests run, all of your preventative tests done. So I understand we're focused on COVID-19, but there's still folks dying of heart attacks and strokes. There are still folks dying of cancer here in this country. And so we need to also keep those on our radar screen, because at some point, with the amount of knowledge that we have in this country, we're going to get on top of this COVID-19. No doubt about it. Some of you have already seen the changes that have happened because we have a new administration. So we're going to get on top of this. I'm thinking, I'm hoping by June, July of this year, things are going to be a whole lot different than they are right now. So once we get up to that 70 to 85% immunity throughout the country, that many people have gotten the vaccine, then everything will look a whole lot different than it looks right now. So all of you men out there, the first thing I need you to do is go and make an appointment to see your doctor. If you don't have a doctor, get a doctor. If you don't know how to get a doctor, call 800-788-0941. And here at Healing Our Village, we'll help you with that. We'll help you figure that out. All right? Because everyone needs to have their own primary care physician that they can go and see at least once a year. So let's talk about the state of men's health here in the United States. We know that men are half as likely to see their healthcare provider for a physical exam than women. Men are more likely than women to be uninsured. And that didn't used to be the case. We used to have a lot of employers who gave health insurance. But now what we see is there's a lot of employers are not giving you a full 40 hours. And unless you're working 40 hours a week, they're not giving you health insurance. So that's why what Joe Biden just did with opening up the exchanges for the Affordable Care Act, so that now you can go there and get health insurance, that was a big deal. Because until he did that, you had to wait until November to be able to get back into the Affordable Care Act. So take advantage of that. Even for you states that don't have the Medicaid expansion in your state, that's okay. You can still go to that website and see what's out there for you. And we know that men are dying at higher rates than women, 9 out of 9 of the top 10 causes of death. So when you look at this graph that I have here, you see in most cases, men no matter what their ethnicity, they're at a higher rate of having these issues than women and dying than women. All right, so that's why I'm here today talking about men's health. Now, why don't men go to the doctor? Well, a lot of it has to do with their upbringing, right? And society has played a big part in men's health decision not to go to the doctor. Boys are used to be trained to not cry, that they needed to be big boys. They needed to tough it out, all right? Now, things have changed a little bit, I think, over the last, 5 to 10 years, but still a lot of that is out there, especially among men who are in their 50s, 60s, 70s, 80s, because that's the way they were brought up. Again, I mentioned a lot of men don't have health insurance as part of their jobs. And some men decide that they're just going to wait it out. They're going to tough it out just to see if they feel better. All right. So they don't consider health to be the top priority, but it needs to be, because if you lose your health, you lose everything. You lose everything. Because if you're sick, you can't go to work. And if you can't go to work, you can't make no money. All right, so this health needs to be put up at the very top of your priority list. And I want you all to really take this stuff serious. So in 2021, we're going to make a difference in the lives, especially of people of color. Now, why do men, what are the excuses when your significant other says, okay, I want you to go to the doctor, and this is what you tell them. You say, well, I'm feeling pretty good, so I don't think I need to go to the doctor. Or I'm too busy to leave work and go to the doctor. I don't want to use my sick days for that. Now, does that make any sense to you? How are you not going to use your sick days to go see about not being sick? I don't get that. You need to take a sick day. There are people who die with thousands and thousands and thousands of hours of sick leave. And you know what they say, which is funny to me, especially for you county employees, city, state, you actually are banking those sick leave, and some jobs let you keep it. And then when you retire, they pay you out on your sick leave. So you guys are holding on to your sick leave days so that 20 years from now, 10 years from now, 5 years from now, when you retire, you'll be able to get paid on it. All right, well, let me explain why that makes absolutely no sense. So if you die before you retire, then what happens to your sick leave days? Yeah, okay. All right, so let's not do that, folks. All right, listen, if you especially nowadays with COVID-19, if you're not feeling well, if you're having some of those symptoms of COVID-19, you need to stay home and try to figure out if in fact you have the virus. So it's important that you got to get to the doctor. Now, some of you don't like your doctor. You don't trust your doctor. Some of you don't communicate well with your doctor because they may not speak English as a first language. So you're having a hard time understanding what they're telling you, but you don't want to say nothing. All right? So it is important that you love your doctor. I love my doctor. My doctor is tough. That he knows what he's doing. He's got the best education. He's been doing it for at least 15, 20 years. I know that when I go see my doctor, he's going to give me the best care. So if you don't trust your doctor, and you know if you trust him or not, then you better change doctors. And again, if you need some help with that, give us a call. We'll help you with that. But trust of your physician, of the healthcare system is one of the major reasons why African Americans especially end up dying or end up having more serious complications because they delay, because they don't trust their doctor. Listen, I do health fairs. I go and I used to take people's blood pressures, blood sugars up until COVID-19. Then I had to stop, and hopefully we'll get back to our health and wellness screening programs. But I used to do all these screenings, and people would, say to me, their blood sugar would be high. It'd be like 300 that day. And I'd say, oh my God, your blood sugar is sky high. Has anybody ever told you you had diabetes? And they said, oh, yeah, no, they told me I had diabetes about 3 years ago. I said, well, did they give you a medication? And they said, yeah, but I didn't take it. I said, well, why not? They said, because didn't think the doctor knew what he was talking about. Okay, listen, that's a problem. If you trust your mechanic more than you trust your doctor, that's a problem. So you have got to get to this place where you feel like you are going to the best place with the best care. And the other major reason is that you're afraid that they might find something wrong. So you, Eveline and the Wiz, remember, you don't want no bad news. But you got to go ahead and do it because you want to, even if you do got something wrong, you want to catch it early. That's really important. All right. Now, a lot of men don't go and get their prostate exams, which they're supposed to have every year, because it's uncomfortable. All right. But listen, if you catch that prostate cancer early, it's got a great recovery rate. So don't not go to the doctor because you don't want to get your prostate examined. It's really important. So here are some of the top 5 men's health issues. So we got your diabetes, we got your heart disease, we got your cancer, but a lot of men, especially now, are suffering from mental health issues like depression, anxiety, stress. You know, we're all stressed. I'm stressed. I'm more stressed than I have ever been because this whole COVID-19 and having to reinvent my company and reinvent how I deliver my education, all of that's been stressful. And then there's also sexual health issues. That also takes men to the doctor. In fact, a lot of times a man will go to the doctor because he has erectile dysfunction before he's going to go to the doctor to see about his diabetes or HIV. That also sexual health. That also takes men to the doctor, right? So they'll go for those reasons before they'll necessarily go because their blood pressure is high. So all of these are what we're going to talk about today. So let's start off with diabetes. We know that diabetes is the leading cause of heart attack, strokes, and kidney disease. We also know it's the leading cause of amputation. And diabetes cannot be cured. People tell me all the time, oh, my diabetes has gone away. I lost 20 pounds. Changed my eating habits, and my diabetes is cured. I don't have diabetes anymore. That's not true. What you did was you managed your diabetes with weight loss and changing your eating habits, but it's still there. And if you gain the weight back, or if you start eating the way you used to eat, it's going to come back. So you can't cure diabetes, but you can manage it. We know that 90% of the people that have diabetes have what they call type 2 diabetes, and that the keys to preventing diabetes is losing weight, getting more exercise, and eating a low-fat, low-calorie diet. The data has shown that if you lose somewhere between 5 to 7% of your body weight, so you get on the scale today, you weigh 200 pounds. If you lose 20 pounds, all right, if you lose 10 pounds, you'll be able to see a reduction in your blood sugar and your blood pressure. A lot of you out there have pre-diabetes. Pre-diabetes is the state you're in before you go on to develop full-blown diabetes. Healing Our Village has a diabetes prevention program. All of you who may be in that category of pre-diabetes, you need to join the Healing Our Village pre-diabetes workshops we do every Tuesday at 6 o'clock. All right, we need you to be on there. How do you know if you're at risk for pre-diabetes? There's something called the pre-diabetes risk test. Pre-diabetes risk test. Go to Google it right now. Go up there, take the test. If you score 5 or higher, you may be at risk. If your doctor has told you you have metabolic syndrome, that's the fancy name for it, metabolic syndrome. That's basically a state, so pretty much pre-diabetes. We can actually make some of you go back to normal glucose tolerance, go back to no diabetes if you start working on it with us now. So for more information about that, you just go to the website and all our information is there. Let us know, send us an email, tell us you want to enroll in the program, and we'll have one of our coaches call you and get you all set up. We know that about 30 million Americans actually have diabetes, and what diabetes does is affect your body's ability to turn the sugars and starches that we eat into fuel. We know that people with diabetes spend about 2 to 3 times more on their medical care, and that men with poor blood glucose control are prone to erectile dysfunction. So you're going to the doctor to get those pills for erectile dysfunction, which all you really need to do is get your diabetes and your blood pressure under control, and you'll probably find that you don't have that problem anymore. All right, so I'd rather you do that than necessarily taking pills that potentially may have some side effects. So think about that. Cardiovascular disease and diabetes go hand in hand. People with type 2 diabetes, what they die of is heart attacks and strokes. And they die way earlier than they should because of that. So as you can see, as you get older, that last set of bars, your blood sugar goes up and your risk of diabetes goes up if you have diabetes in your family. Diabetes is a genetic disease, folks, so it usually runs in families. So we know that this is something that we need. If you have it in your family, you need to start keeping track of your blood sugars to make sure if you either have prediabetes or, heaven forbid, you have diabetes. Let's talk about cardiovascular disease. Cardiovascular disease is your blood pressure being high, which is called hypertension. It's your heart failure because your heart is working overtime, and so it can't keep up, and so now it's going into failure. We know that when you talk about cardiovascular disease, we're talking about heart attacks and strokes. We know that if we intervene early by, number one, you getting your checkups, losing the weight, especially if your BMI is 30 or greater. All right, how do you know what your body mass index is, your BMI? Again, go Google it, put in BMI calculator, and put in your height and weight, and it's going to tell you what your BMI number is. You can find that out right now while I'm talking to you. If you're 30 or greater, that means you're overweight. If you're greater than 35 or greater, that means you're what they call obese. All right, so there's overweight and then there's obese. We know regular exercise, including some weight training, is good for cardiovascular disease. You got to limit your alcohol, you got to limit your caffeine, and you got to quit smoking. For those of you who are still smoking cigarettes, you got to stop. That nicotine is bad for your blood vessels and it's bad for your heart. But also you got to reduce your stress. So my blood pressure usually runs very low, very low. And because of all of this stuff going on in my life, I broke my arm in December. I just got it out of the cast, but I still can't do everything I need to with it. And I'm in a lot of pain from that breaking my elbow. Who knew that an elbow break was one of the worst breaks in terms of pain? I didn't know that. Anyway, I'm stressed out. I'm stressed out because I'm not functioning at 100%. And I'm used to functioning at 100%. So I'm stressed. And my blood pressure's gone up a little bit. So I know what's going on. I know I'm stressed. I'm trying to start working through getting back in control of my life so that I can take the stress down. So you all have to do the same thing because we know, especially in African Americans, that stress will increase your blood pressure. Smoking, I talked about that. 87% of the lung cancers are caused by smoking. And that's cancers in your esophagus, in your pharynx, in your pancreas, in your uterus, in your kidneys, in your bladder. All of those can be exacerbated because of smoking. Smoking is a trigger which can turn a regular cell into a cancerous cell. So that is why this smoking is and stopping smoking is so important. Why do people get hooked on smoking? Well, there are actually chemicals in the brain that are released when you smoke. All right, so these chemicals actually make you feel better. It brings pleasure or it brings arousal. That's dopamine. A lot of women I know say I got to keep smoking because it decreases my appetite. That's because of the release of norepinephrine and serotonin. Some people say, well, when I smoke, I can think better. I'm able to remember things, memory improvement. That's because of a chemical called vasopressin and acetylcholine. So we know that a lot of you maybe smoke because you're feeling anxious or you're tense. And that's because of beta endorphin that's secreted when you smoke. So there is an actual chemical reason why smoking makes you feel the way you feel. Also, we know that this whole idea of putting that cigarette to your mouth, it becomes a ritual. This whole cigarette, and flicking the ashes, and I mean, back in the day, that everybody was smoking cigarettes because they thought it made them look cool. In fact, all the commercials made you look like you were cool if you smoked. Okay, so we're in a different time though. We don't have all those commercials anymore promoting smoking. So for those of you who are still smoking, especially if you have diabetes or hypertension, you have to stop. We also know that smoking is associated with certain activities that you do. So you have a cigarette with your morning coffee, or at work when you're taking your break. Yes, when you go out and have a cigarette, or maybe when you're driving in the car, or having a conversation with somebody, or when you go out drinking at the bar. We haven't been doing any drinking at bars, at least in most states. There's still some states where people are doing that. But a lot of smoking happens in those places as well. Now in society, it's a lot harder to smoke than it is before, because there's a lot of no smoking, because everybody now understands the damage that happens with secondhand smoke. So a lot of people, there are no smoking zones, but and even in airports, they have a little place where you go now if you want to smoke, but you can't smoke in the airport. So there's all these things that are happening, I think now, that fewer people are smoking, but there's still a whole lot of people that are smoking. In fact, people are now, instead of smoking cigarettes, they're smoking cigars. So there's a whole cigar bar, hookah bar thing going on, right? Where people go to these places, all right, and that's got tobacco. In fact, it's worse than cigarettes. They're probably about the same. But anyway, people fail to quit because when they start to quit, they start having headaches, or they get irritable, or they get depressed, or they gain weight. All of these things are why people continue to smoke. In fact, most people, after they've quit, resume smoking in about 48 hours. Okay, let's talk a little bit about prostate health. When you talk about men's health, prostate is usually what we talk about, right? And we know that there's something called benign prostatic hypertrophy. So what happens is your prostate becomes enlarged. Okay, now this is a progressive condition, and how you'll know that you have it is all of a sudden you have the need to urinate. So people have frequent urination, or you'll notice that your stream is not as good as it used to be. All right. Or you feel like you have to urinate, but then you don't, or you're not able to completely empty your bladder. All of these are what you see if you have an enlarged prostate. We know it affects about 50% of men age 50, about 90% of men by the 80 years old. Less than 50% of men are diagnosed. So a lot of men out here who are listening to this program have BPH, have benign prostatic hypertrophy. And less than 20% of men are being treated. So this is a very common condition. People don't know that they have it, and this is a problem. So again, those are the symptoms that if you're starting to have those symptoms, you need to talk to your doctor about that. There's also an infection of the prostate called prostatitis, which can be just treated with antibiotics. So we want your prostate to stay healthy. We don't want it to be enlarged, because we know that prostate cancer is the number one cancer in men. So when you get to age 40, we want you to get a baseline prostate exam. And then every so often, when you go back to see your healthcare provider, they're going to get yearly exams and after the age of 50. And it's important that you have safe sex. So using condoms, unless you're with, a one partner and you're not, having multiple partners. So you having regular safe sex is also really important. All right, let's talk a little bit more about just cancer in general. In 2020, there was about 606 or so thousand people who died of cancer in the United States. We know that the American Cancer Association has a lot of really super great information on their website. They know that they keep track of all the data. All right, we know that the approximate lifetime risk of developing cancer is 1 in 2 for men. And over the course of a lifetime, 1 in 2 men and 1 in 3 women will get cancer. Cancer is really prevalent in this country. It's way more prevalent in this country than, say, in other countries. And there's lots of reasons for that. A lot of it has to do with environmental causes. So we're the air we're breathing, the water that we're drinking, the pesticides that we're using on our foods, all of those things can again trigger a regular normal cell to switch over to a cancerous cell and start to multiply. So it's very common, and prostate cancer is very common in American men. Lung cancer as well. It is a fatal cancer for American men. That's definitely due to smoking. And the majority of cancer cases happen in men who are 55 years or older. So people really are concerned about the big C. Everybody's worried about cancer. So that's why regular checkups and going to that doctor at least for one checkup a year is so critical, because they'll run a battery of tests that'll be able to detect, in fact, if you have cancer. So it begins in the cells, and as you know, the cells are what are the building blocks of the tissue. And when that cell turns into a cancerous cell, it starts to divide. And as it gets bigger and bigger, it creates a mass. And that cell mass is called a tumor. Now, those are the cancers that are caused by tumors, but there are also blood cancers like leukemia, right? So that's not necessarily a tumor, all right? Now, not all tumors are cancerous. And so, for instance, women sometimes get a mass in their breasts, and they go in and they have that mass tested, and they find out that it tumor is benign. It's not malignant. Now, benign tumors are not cancerous and are rarely life threatening, whereas malignant tumors are cancerous and are serious and may be life threatening. The trick about this cancer thing is you got to find this tumor when it's small. And hopefully it's walled off. But by being walled off, that means it's less likely to spread. You don't want this cancer to get big, because then its ability to metastasize, to spread to other organs throughout the body is increased. So if you're going to get a cancer, we want to detect it early and we want it to be small. Now, we talked a little bit about prostate cancer before. It's part of a men's reproductive system, the prostate. The urethra, that's the tube through which your urine flows. And this may cause the urinary problems that I mentioned in terms of stopping the flow of the urine or the bladder to the penis. We know that African American men are very high risk of not of getting this cancer, but definitely of when they get detected, it's usually far along. So we want to make sure that if you're African American man, again, you're getting these checkups. We also know that there's a few studies that suggest that men who eat a high fat diet and lots of meat in their diet, they're at increased risk of prostate cancer. So we're always encouraging you to increase your fruits, increase your vegetables, because we know where it lowers the risk. We've talked a little bit about the interrupted flow of the urine. We talked about the fact that prostate enlargement can actually make it harder for you to get an erection. If it's far along, you can actually even see blood in the urine or the semen. And sometimes the way you'll know that there's an issue is you may have some lower back pain or pain in your hips or your upper thighs. Those are other signs that there may be something going on with your prostate. What do you do if that happens? Well, you get a digital rectal exam. There's a blood test that you can have that's called a prostate specific antigen, a PSA test. It's a blood test. And they look, if those levels are high, if your PSA levels are high, then that may mean that you have inflammation or infection of the prostate. So, and it may result from prostate cancer, this inflammation or this infection. So all of this is why we want to keep track of your PSA levels. Now, the interesting thing about African American men is sometimes that PSA test is higher than them than in their Caucasian counterparts. And even though it's high, they don't necessarily have prostate issues. So that's why going to a doctor that's used to taking care of African American men is a good thing, so that they know some of the differences in the tests, so that you don't get a false positive test from them. Let's talk about colon cancer. My husband actually died of colon cancer at the age of 38. So he was healthy, tennis player, the picture of health. He didn't talk to me about it at all. Come to find out, he was having blood in his stool. Didn't never mention it to me. When he finally said it to me, and I got him in to see a doctor, immediately it was too far gone. It was too big. They couldn't do anything about it, and it had already started to metastasize. So colon cancer is actually one of the easiest cancers to cure. So if I had just known sooner, if he had gotten in to see the doctor, he'd be here right now. So we know that the colon and the rectum are parts of the digestive system. And the large intestine is just a big long tube, right? Where your bowel, where all of the food goes through and then is excreted through the rectum and your feces. So that colon is about 4 to 5 feet long in terms of how long it is. And the part of the colon that joins the rectum is the sigmoid colon. And the part of that joins the small intestine is the cecum. So that's a picture there that shows you all the different parts of your intestine. So you got the small intestine, you got the large intestine, you got the sigmoid colon, and then you got the cecum. Okay. We know that in terms of colon cancer risk, more than 90% of people with this disease are diagnosed after the age of 50. My husband had colon cancer at 38 years old. So it's not something they even looked for because he was way too young to have colon cancer. Sometimes people have polyps, colorectal polyps, and they are growths that are within the inner wall of the colon or the rectum. And so when we talk about having a colonoscopy, especially when you get to that age of 50 on a regular basis, we're looking for these polyps. Now, some polyps are benign, they're non-cancerous, but some of them actually can be cancerous. So it's important to remove those polyps, all of them, so we can reduce the risk of colorectal cancer. We know that there's sometimes a family history of colon cancer. And so it runs in family. We know that people that have maybe ulcerative colitis or Crohn's disease, that these patients sometimes have an increased risk of inflammation of that colon, which is not a good environment, and it actually increases the risk of developing colorectal cancer later on. We talked about the high-fat diets. We also said that calcium, folate, and fiber, they may increase the risk of colorectal diets that are low in calcium, folate, and fiber may increase the risk of colorectal cancer. So you'll hear people talk to you all the time about getting more fiber in your diet so that you'll be able to decrease your cancer risk. And then we already talked about smoking. It increases the risk of developing the polyps and also developing the cancer. Let's talk about lung cancer. These are cancers that begin in the lung. There's basically divided into two major types. There's small cell lung cancer, and non-small cell lung cancer. These are the two types, and you determine that by looking at the cells through a microscope. In non-small cell lung cancer, it's more common. It generally grows and spreads at a very slow rate, whereas small cell lung cancer, also known as oat cell cancer, is less common, okay, but it grows very quickly and is likely to spread to the other parts of the body. So that's the one that they look out for, because that's the one that can be much more dangerous for you. Again, we talked about risk factors. So we know it's smoking cigarettes, but also that secondhand smoke. So just being exposed to tobacco smoke Again, we talked about the air, exposing patients to toxic air environments, especially say in their workplace. All of those can increase your risk of lung cancer. Um, there are some factories that actually have something called radon. And radon is an invisible, odorless, tasteless radioactive gas that occurs naturally in soil and rocks. And it has been found to cause damage to the lungs, which can lead to lung cancer. Asbestos. Some of the older apartment buildings, some of the older houses actually have asbestos as part of the roof that they have, the roof linings that are up there. So those asbestos fibers tend to break into small particles. They can float in the air, they can stick to your clothes, and if these particles get in your lungs, it can actually damage it. So nowadays, some of you know, if you've ever sold a house or bought a house, you have to give a disclosure on that sales agreement if there's any asbestos up in the roof of your house. You have to talk about that, right? There are some people that are in the mining industry or various manufacturing industry, or let's say they actually make the insulation. All right. Back in the day, that insulation, again, in your roof was made of asbestos. So those people were at higher risk of getting lung cancer. We always hear about the folks working in the mines, right? That whole mining industry that you have in Wyoming and different parts of the country. Those folks breathing in the stuff that they're mining increases the risk of lung cancer. We also know that just the air that we breathe, high pollution areas, have been found to be linked to lung cancer. So that's why it's important when we talk about clean energy, when we talk about improving our air quality. That's why it's important, because a bad air quality can lead to lung cancer. All right. Now, we know that in terms of personal history, a person who has had lung cancer once is more likely to develop a second lung cancer compared to a person who's never had lung cancer. There are certain lung diseases, such as TB, which increases the chance of developing lung cancer. So these, again, are all the various risk factors. My brother actually died of lung cancer. Now, he was a smoker when he was young, but then he had stopped smoking. And he died of lung cancer. By the time he actually got diagnosed, it was so big they couldn't do anything about it. It had already metastasized. Okay. He was in his late 30s. In fact, my brother died of lung cancer the same day that my husband went to surgery for his colon cancer. So I left my brother's deathbed where he died of lung cancer and went to the hospital to wait in the waiting room for my husband who was getting surgery for his colon cancer. Now, people talk to me all the time about a bad day. They had a bad day. Let me tell you about bad day. That was a bad day. That was a bad day. Both young, both should not have had this cancers, and both had symptoms where we could have caught it early. My brother was coughing and having some pain in his chest and didn't go to the doctor to see about it. So, chest pain, coughing up blood, shortness of breath, wheezing, hoarseness. If you keep always having a bunch of bronchitises or pneumonias, swelling in the neck or the face, all of a sudden you lose weight or you don't have any appetite. But let me tell you, folks, by the time you start losing weight and not having an appetite, oh, that thing's gone. It's already moving. So when you have any kind of, my brother this is what was interesting. He noticed that when he was laid on one side of his body when he went to sleep versus a different side, it would cause him to cough. And he never thought that was something to think about or something to worry about. Yeah. So that was one of the major early symptoms that he had a problem, because he didn't have asthma. He wasn't sick. So if you're coughing and you're not as a smoker or on an ACE inhibitor that causes cough, you shouldn't be coughing. So you need to go check out what's going on with yourself. We also know that if you can find the causes of the system, then the doctor sort of evaluates you. They do a personal history, they do a smoking history, they do an environmental occupational history so they can maybe figure out what's going on. That's what they do in terms of screening. They may actually ask for some sputum so they can look in the sputum and look at the various what the sputum sample looks like. And they may actually do a biopsy, a removal of a small little piece of the tissue in your lung. They send that to a pathologist and finds out if that person has some kind of cancer. Testicular cancer, also seen in men. Most common form of cancer in men ages 15 to 39. So this is kind of cancer that's happening in young men. All right. We know that white men are more likely to get testicular cancer than African American and Hispanic or Asian men. And we know that testicular cancer is less common among older and middle-aged men. So this is something, again, that's happening in the younger population. Erectile dysfunction. You've seen a lot on this. People know all about erectile dysfunction. All right. It's estimated that about 150 million men worldwide suffer from erectile dysfunction, and it's going to happen by the year 2025. By the year 2025, it's going to go up to 322 million. So we got 150 million right now, and it's going up, not down. All right. We know that it can be caused by certain medications. Some of the blood pressure medications that you may be taking may be contributing to your erectile dysfunction. So when you go to your pharmacy and get your prescriptions, you need to ask your pharmacist, is this medication cause erectile dysfunction? All right, we know that smoking marijuana, cannabis, may actually reduce sexual function. Now, there's some conflicting studies about that, but there are some studies that have shown that. We know that sexually transmitted diseases, the more sexual partners you have, the greater your risk of getting an STD. And over 20 million new cases are diagnosed each year of these STDs. So gonorrhea, syphilis, and of course your HIV/AIDS, your chlamydia, but your gonorrhea, your syphilis, and your chlamydia are higher than they've been in a long time. So we're giving out more penicillin shots than we used to 10 years ago. All right, so this is on the increase because, there's just a lot more sexual partners that people are having than they had 20, 30 years ago. So these sexually transmitted diseases are on the increase. Talk a little bit about HIV/AIDS. I think people know a lot about this. I think that there's been a lot of really good information about HIV. I think that most of the people that I talk to are really sort of, know more about that, right? Than they do say about diabetes or hypertension, right? We know that HIV/AIDS is got a lot of amazing new medications that we didn't have before for the management of this, and now there's even something you can do to prevent it. All right, so there's a lot of really amazing research that's been done in this area. We know that symptoms due to underlying infections or malignancies resulting from specific damage to the immune system is what we see in HIV/AIDS. We know that it decreases the ability of your body to fight infection because it decreases your T cells. A lot of people know about T cells now because of COVID-19. All right, so we know that those are those T cells that are fighting that virus. So a lot of people are now learning more about our immune system and how it's important to have antibodies because of all the COVID-19 information that's out there. In terms of just how prevalent HIV is, it's every 9.5 minutes, someone in the United States is infected with HIV. I don't know if you know it's that often, but this is something that's happening, and in certain pockets of the country, it's happening more than in others. We know that there's approximately 40 million people right now currently living with HIV infection. About another 25 million have died from the disease. In the United States, approximately 1 million people are currently infected. So it's definitely out there. This was something that we actually learned about in the 80s. This is when we've been working with this thing for a while, which is why I think we know a lot more than we did before. And we have these really great drugs that we have out there. That this HIV virus belongs to a lentivirus subgroup. So it's a retroviridal family, and that family of viruses is known for persistent viremia. So it's in the blood, right? That's what viremia means. It can also affect the nervous system and weakens the host immune system. We talked about that. What does it feel like? How do you know you got it? Well, it's really, sort of the reason why we don't get it diagnosed is the symptoms are sort of non-specific. So fever, sore throat, headache, tiredness, skin rashes, maybe enlarged lymph nodes. These symptoms usually disappear on their own within a few weeks. So what you have to do is, if you think that if you're having unprotected sex, which nobody should be having unprotected sex, and I know that people are having unprotected sex because we got babies being born. See, and I told my kids when they were young that sex makes babies. Okay, so if you're having sex and you're having babies, then that means you're having unprotected sex, and that's a real problem. Nobody should be having unprotected sex. So if you're having that, you need to be getting yourself tested for HIV on a regular basis to make sure you know what your status is. So you're not infecting anybody else. All right. We know that all persons infected with HIV pass through a phase of symptomless infection. It's called clinical latency. And then from that stage, you then go on to having sort of more of a full-blown infection. So during this clinical latency, the virus continues to multiply. It actively infects and kills the cells of the immune system. So this virus basically destroys the CD4 cells that are the primary infection fighters. An HIV antibody test is the only way to tell if you're infected. So that test is readily available for you to get. And when the HIV then enters the bloodstream, it begins to attack the white blood cells. We talked about it, your T cells, your T4 lymphocyte cells. That's the major cell they affect. And so then if you have these antibodies, the presence of the antibodies to HIV result from HIV infection. So when they're testing you for HIV, they're looking to see what those antibodies are. So who should be tested? Okay, we talked about unprotected sex. If you're someone who have been injecting drugs of abuse, right, or sharing needles, or syringes, or cotton or water with others, you can be able to contract AIDS or HIV. Again, unprotected vaginal, anal, or oral sex with men who have sex with men. All right. Again, sex for drugs or money. Or have you been diagnosed with or treated with tuberculosis or an STD like syphilis? All right. All of these people tend to be at a higher risk, and so they need to be tested. Have you received a blood transfusion or clotting factors between the years of 1978 and 1985? If you plan to become pregnant, you need to get tested. If women are infected with HIV, medical therapies are available to lower the chance of passing on that virus to the infant before or during the birth. So it's very important that if you plan to become pregnant, or if you're already pregnant, you need to know what your HIV status is. We talked a little bit about the HIV antibody test. That's something you can get right there at your doctor's offices. And if you don't have health insurance, you can go to free clinics, or you can go to some of the federally qualified health clinics, which basically only charge you based on your ability to pay. So these tests are out there where we're trying to find out if in fact you have these antibodies. There's the two tests that you may have heard about is the ELISA or EIA test. It's repeated 2 times if there is a reaction on the first test. And then the Western blot is used to confirm the first 2 tests. So these are the tests that are out there for the HIV. Um, there's also these other ones that can be done. They're not really done very often, but there's something called the immunofluorescent assay, the nucleic acid testing, or the polymerase chain reaction testing. All of those are there. There are actually some home tests that you can get. You can send off for. There's actually an oral test called OraSure or OraQuick, which is FDA approved, and it uses oral fluids to be able to see if in fact you have HIV. So again, I just think that the amount of research and innovation and with these viruses and with the testing is just amazing now. So you don't necessarily have to do a blood test. There is the OraQuick Rapid, which is a rapid test that is available out there. The multi-spot or the Reveal G2, the Unigold, all of these are tests that are available in the marketplace that are being used to test for HIV. And I mentioned there is some home tests that you can get now to be able to test for the HIV. Mental health, this is a big men's health issue. It's not just the mere absence, mental health is not the mere absence of mental health, but it's a state of your well being. It's how well you feel, how productive you are, how normal you feel. How do you describe your feeling normal? What's your normal? Everybody's normal is different. Do you feel like you're making a contribution to society, or do you just feel incapable of being able to do that? When you talk about mental health or mental illness, it's basically a collection of diagnosable mental disorders. But the most common is stress, anxiety, and depression. When you look at the number one and two prescribed drugs in the United States of America, it's for depression and anxiety, stress. We have a lot of that here. Okay, $1 billion industry of drugs being used for depression, stress, and anxiety. So, what makes you have these mental health issues? What causes it? Well, there's all sorts of causes. Divorce. A lot of people getting divorced, separated. Loss of employment. We have millions of people right now who have lost their jobs by no fault of their own. Okay, they used to work for a restaurant, the restaurant's closed. So there's a lot of unemployment right now. That's why getting everybody back to work is so important. The birth of a child. You know, the birth of a child is a happy occurrence, but now you're not sleeping. Every 2 hours you're waking up. You have this new person in your life you got to take care of, and they're not going away. They're going to be around for a while. You used to say that the kid will be out of your house by 18, right? That was I know I was out of my mama's house at 18, but nowadays kids don't leave; they just stay, right? You're trying to get them to go; they won't leave anyway. So the birth of a child can be a stressful situation for you, moving to a new job, a new home, natural disasters, of course, and there is sometimes some genetics or heredity that occurs. Let's talk about depression. It affects about 40 million people have that diagnosis of depression. And men are 4 times as likely to commit suicide due to depression than women. And without treatment, the symptoms of depression can last for weeks, months, years. So we know that right now in the United States of America, depression is the leading cause of disability in the United States. Stress, how do you put your finger on that? It's ubiquitous, right? We know that stress can both be, can be a little positive for some people, but in most cases, stress is negative. And it also can occur due to factors that are outside of the body. All right, but it can also occur because of things going on inside the body. So having a chronic illness like diabetes, hypertension, arthritis, etc., those can actually create stress. Everybody has the ability to alter their stress levels. So that's what I want you to understand. You're in control of this thing. All right? You can decide if you're going to allow situations and your circumstances to control you, or are you going to control them? Sometimes you have people in your life that are stressful. And that's a hard conversation with yourself, you know? It is really important that you monitor your immediate environment. And if there's someone or something in your immediate environment that's causing you stress, then you need to move away from that. Okay? My mama used to say that some people need to be treated with a long handled spoon. See, everybody can't get close. There's some people that need to be, loved from a distance. Okay? All right. So you have to figure out, sit down, take some time, some quiet time, and figure out, am I stressed? And if I'm stressed, why am I stressed? And who is stressing me out? And what is stressing me out? And you need to fix that. Okay. And it can be fixed. That's what I'm doing right now in my life, figuring out who's stressing me out. Okay. So we know it is a physical and mental response. We know that when you are stressed, that there are certain chemicals in your body that are sometimes secreted. You have to figure out how you're going to deal with and cope with your your daily ongoing situations. So is it your job that's stressing you out, or the people at your job? Is it your boss who's stressing you out? All right. Is it your family? Is it your financial situation? Right now, a lot of people are living, for check to check, or they don't have any check. They don't know how they're going to pay the light bill and the gas bill. Are they going to be evicted from their house? There is so much going on with that. And acute stress. That is the response to an immediate or life stressing situation. So an immediate threatening situation, someone pulls a gun on you, right? Well, that causes stress. That would be considered an immediate or life threatening situation. When you talk about the symptoms of stress, you're looking at your emotions, your mind, or your behavior, and your body. I love this slide because it sort of breaks it down for you. So, behavior, are you accident prone? Are you lost your sex drive? Do you have sleepless nights? Are you have insomnia? Are you restless? Are you smoking more? Is it a mind thing? Are you worrying? Are you always just, thinking all the time? Nightmares can be a form of stress. People don't think about that. Are you negative? I know people that if it wasn't for bad news, they wouldn't have no news. They just every time you talk to them, it's just they go on and on about this and that that's not happening. One of the things my friends say about me, I got a lot of amazing friends, and they'll tell you that as for the years that they've known me, I've known some of my friends for 50 years. They'll tell you that Coleman can find a good reason for lemon seeds and peach pits. One of my best friends told me that. I'm always trying to figure out how to make lemonade. I'm not going to let this thing get me down. I'm not going to do it. Now, of course, I have periods where I go through this stuff, but then I try to pull myself out of it because, again, I'm in control. And so I'm going through that right now. Right now, it's a lot of stress going on. We're living in a stressful situation. So I'm trying to do the things that I need to do to be able to handle that stress. The emotions of stress. If you're not finding things to be fun and funny? Are you irritable? Are you depressed? Those are all the emotions of stress. And then body aches. That body shows you have stress because maybe you're breaking out in rashes. Maybe your eczema is worse than it used to be. Maybe you're not get able to catch your breath. You're achy, and you don't want to get out of bed. You just feel bad. You don't know exactly why you feel bad, but you just feel bad. All right, so these are the four areas of stress. And so these are the symptoms that you need to be looking for to see that, hey, I think I might be stressed. Anxiety, very common, especially in this country. We know that there are certain people that have what they call post-traumatic stress disorder. All right, so we talk about that with the military, that they have PTSD. But if you've had a trauma in your life, if you've just lost a loved one due to COVID-19 and you didn't get to see them in the hospital and you didn't get to go to their funeral, all right, you had to see their funeral on Zoom, which is just insane to me, okay? You're probably going through some PTSD. You probably have some anxiety because of that. So these are things that are there that we're going through. Of course, natural disasters, all of these things can make you feel anxious, all right? So you have to figure out how you're going to calm down. What makes you relax? And you need to do those things. Just a word about immunizations. There are certain immunizations and vaccines that men tend not to get. If you're at a certain age, we want you to get a pneumovax, so that prevents you from getting pneumonia. Flu shots. October, November is the best time to get vaccinated, so that in January, December, you won't get the flu. For those, because of COVID-19, we're really recommending that people get flu shots. So that's something that you should still do. And if you get an immunization, just like with COVID-19, when I got the immunization in my arm hurt for a couple of days. So you'll see that sometimes with immunizations or vaccines. What they call it injection site reactions. So sometimes you get pain or redness or swelling or muscle aches. Some people get nausea, fever, or they actually feel like they're getting the flu as part of the flu shot, but we still encourage you to take it. This is something that people don't talk about. Hepatitis C. There are a lot of people that actually have hepatitis C and they don't know that they have it. One of the biggest symptoms that is like a fatigue, or again, that flu-like syndrome, depression, tenderness in the abdomen, jaundice. Hepatitis C is basically a liver disease, right? But it's something that you can actually get a vaccination for, and you can and actually treat that. So if you're having any of these symptoms, you need to talk to your doctor about a hepatitis C vaccination. An ounce of prevention is worth a pound of cure. We talked about the annual physical exam, full workup every year. Men need to get their PSAs. They need to get their prostate done. They need to get their colonoscopies so we can make sure that there's no problem with polyps, etc. We need to make sure that everyone in your family is eating healthy, eating diets that are low in fat, high in fiber. The man is the role model of the family. You need to sort of be the person that everybody's looking to, right? So I want you all in 2021 to do a better job at being sure that you're getting all your prevention health exams, that you're the one getting your 150 minutes of exercise a week, that you're the one eating the low fat, low cal, high fiber diet. And that's what's happening in your household. Less cookies, less ice cream, less candy, less chips. All of that is we want you to take the lead on this, because we need you. We need you here, right? I really miss my husband. I still miss him, right? Because we would still be married, because I don't believe in divorce. So we'd be married right now, and I miss him. And I wish I had been able to catch that colon cancer early, because he'd still be here, right? And life would be totally different. I don't know if I'd be doing for your health, but who knows? Here are some websites that are available to you. And to let you know, all of these slides and this program that we're doing right now for your Sugar Busters is going to be up on my YouTube channel. We have these things there. They're also up on my website, hovhealth.com, hovhealth.com. All of the Sugar Buster series is up there. So all of these websites that are on this slide, just go and take a look at this. Share my videos with the people in your life. Share it with your community. Let people know that this is free information. This is up-to-date information. And I'm just giving it out because I want to heal the village. So please spread the word. We're here every Saturday doing these. Please, if you didn't have a chance to ask any questions today, that's all right. Give that 800 number a call, 800-788-0941. That's Healing Our Village, 800-788-0941. You can see there the hovhealth.com website. You can also see my nonprofit website, tlc-global.org. That's my nonprofit. December was a rough month for me. So in December, I broke my arm, broke my elbow, and my building, my nonprofit wellness center in Jonesboro, Georgia, burned down. And I now have to tear the building down and rebuild it. And I need your help. You know, this beautiful program that we're doing for you, and all of the things that Healing Our Village provides in the marketplace, it costs money. And I can't survive on grants and that kind of thing. So we need you all to participate. We're looking for donations to help build back my building. I need you all to think about joining Village Club. It's one of our concierge medicine club. If you have 50, it costs $60, $5 a month, basically. And if you go to that website, you can join Village Club and you'll have your own personal doctor and dietitian and health coach and diabetes educator. And we'll work with you and your family to get your blood sugar and your blood pressure under good control. So we want you to check out Video on Demand, which is on HOV Health. We want you to join Village Club. If you don't have a blood pressure monitor, you don't have a blood sugar monitor, you need to purchase those. We have low cost supplies. Again, on our website, they're Bluetooth blood pressure monitors and blood glucose monitors so that my pharmacists and educators will be able to see your blood pressure. You'll be able to see all of your information right there on your cell phone. So you'll be able to know what your number is. Up on my website, HOV Health, we got articles. I write a column called For Your Health in Urban Sentinel. I have articles up there right now that talk about diabetes, that talk about hypertension. And I just published my article, my first part one on COVID-19. I have 3 beautiful videos up on my website on COVID-19. Tells you everything you need to know about the vaccines, about what COVID-19 is, talks to you about the masks and the hand sanitizers. So HOV Health should be the place you go to see what new things are going on. Also, we have an advertisement up there for green tea, i.e. green tea. Green tea, everyone should be drinking green tea in their diet. The green tea that we sell is the highest in antioxidants. There is no higher green tea with antioxidants in the country. It comes as a liquid. It comes in flavors, peach flavor and lemon and natural if you don't want flavors, raspberry. You just pour that tea right into a glass of water and you're good to go. Makes the water taste good. You can drink it cold, you can drink it hot. And I'm giving you 20% off if you go to that website and click that flyer. We're trying to live healthy lives, folks. We got to do it. If you do that, then and you get on purpose, you help your community, then you're going to be here for a while. And I want that next 30 years to be productive and healthy for you. So come join with me. We're looking for health warriors. Anybody who wants to volunteer to help us in their community, spread the word for Healing Our Village, give us a call. That 800-788-0941. That's 800-788-0941. We need you. Everybody, we need you to come out and help us heal the village. Thank you so much for tuning in today for Sugar Busters Men's Health. And we will see you next week. For those of you who are tuning in, and we're going to take a little bit of a break, and we're going to be back today at 1 o'clock with your For Your Health episode. And that starts at 1 p.m. You'll be able to see it here on our Facebook, or you can go to my website and click live events. Today, we're going to have one of the leading cardiologists in the country, Wallace Johnson. He is amazing. He's also head of the cardiology section for the National Medical Association. And we're going to tell you everything you need to know about hypertension. This is Heart Month. So we're going to be focused on heart disease because African Americans are dying at a rate of 2 to 5 times higher of heart disease. And there's no reason for that. So I want to stop hypertension. That's my goal for this year. So I need you to help me do that. So tune in, set up a watch party, and let's try to stop hypertension in 2021.